So, dear friends, I am glad to see so many faces, people who we already know, who track the advocacy changes, and we are glad that we can involve you, our friends and partners, in this work. And well, the upcoming UNHLM uh, on AMR, which will take place on the 26th of September, is another window of opportunities for our anti uh, tuberculosis work. Well, the part of this work is the inclusion of the important issues by the people living with tuberculosis in this work. So, and from our information resources, you already know that in May, with the support of the Tibet representative, there were multiple meetings with the countries of our region, Norway, Poland, Denmark, Ukraine, and so on. And later, in partnership with the civil society, with the national tuberculosis program of the countries, we did advocacy work with the country missions to the UN, with the representatives of the ministries of health, uh, and we work to include the key asks on tuberculosis in that work. So I would like to give the floor to Greg Payton, representing the Stop TB partnership, and I would like to thank everyone involved in these important strategic initiatives. I am sure that the consolidation of the efforts of the country, national, global level is the key to success of our work. So I wish us all a good and productive
Юля,
meeting.
большое спасибо за
Thank you very much,
вдохновляющие
Yulia, for
слова.
this
И действительно, встреча
inspirational
КП у меня
introduction.
была
And
по
yes, the
антимикробной
United
резистентности
Nations
является очень
high-level
важным
meeting on
событием для всей сферы
AMR
борьбы с
is a very
туберкулезом. Ведь
important
именно
thing for the
туберкулез
whole fight
считается
against
основным
tuberculosis
фактором так
because it is
называемой тихой эпидемии
tuberculosis that
антимикробной
is considered
резистентности. И,
the
как вы знаете, в
main
результате
factor
совещания
of
высокого уровня, которое состоится
antimicrobial
26 сентября,
resistance.
будет
And
принят важный стратегический документ,
on the
политическая
26th of September,
декларация
they are going
совещания
to
высокого уровня по
adopt a very
антимикробной
important document,
резистентности.
political
Этот документ на
declaration on
ближайшие 5 лет будет
antimicrobial
служить важным
resistance.
ориентиром для
And for the
стран,
next 5 years, it will be the
а также для регионов и для
important
всего
point for the
мира,
countries, for
в
the
том числе
region,
для вопросов,
including
связанных с
on the issues
инфекциями, которые
related to
являются устойчивыми
infections
к
that
лечению.
are resistant
Сейчас
to
я с большим
drug
удовольствием хочу
treatment.
передать
Now I'd
слово
like to give the
Грегори
floor to
Пейтону,
Gregory
представителю партнерства
Payton,
«Остановим
the
туберкулез». И мы
representative
хотим
of the
еще раз
Stop TB
поблагодарить
partnership, and
вашу
we would like to
организацию за
thank your
всестороннюю
organization once
поддержку
again for
таких
this
важных инициатив
comprehensive support
гражданского
of the
общества,
important initiatives
для
of the civil
подготовка к
society,
этому и
such
прошлому
as
совещанию
preparation
высокого
to
уровня
this
по
and the previous
туберкулезу и по
high-level
антимикробной
meeting on
резистентности.
tuberculosis and
Пожалуйста, уважаемый
AMR.
Грег, вам слово.
So, dear Greg, please, the floor is yours.
Thank you so much. Thank you for that nice introduction. So I'll start with mentioning that Stop TB back in May developed a set of key asks for the high-level meeting. And we were advised by several contacts that we should really only have 2 or 3 key asks and maybe expect TB to be mentioned once or twice. And we decided to ignore this advice because we wanted a really ambitious set of key asks that all partners would support. We wanted to ensure that we could include all the inputs from all our partners. And we felt that even if many of our key asks are not included in the final AMR political declaration, governments can go beyond what's in the political declaration and show an even higher level of ambition. So we felt, let's make the political declaration the floor for the level of ambition and not the ceiling. We can always ask governments to be more ambitious. And we know in this day and age, when you have to get 194 governments to agree on anything, it's difficult sometimes to get a high level of ambition. So we really went all out, and I think we have a key act document that's about 3 pages long. I'll paste it in the chat so everybody can see it. And I'll just be very honest. I think even though most of the key asks will not be in the final AMR declaration, I think we should not see that as a failure, but rather a reflection of the fact that we have a very high level of ambition. So I think we should continue to use these key asks for advocacy moving ahead beyond the political declaration. And next, I'll maybe talk about the UN multi-stakeholder hearing on AMR. So in late May, Stop TB and a group of CSO partners, including TBEC, went to New York to attend the UN multi-stakeholder hearing on AMR and to promote these key asks. And I think the meeting was a huge success. We succeeded in making TB the most visible issue. During the hearing, we had 7 separate TB interventions from TB partners. And every time somebody had a speech, we chanted the yes, we can end TB chant. So there was a lot of energy in the room, and it was really exciting. In addition to that, we met with 21 missions to share our key asks. And those meetings were great. The missions were very open to hearing from us. We went to visit, we had a great meeting with Ukraine and some other European countries that Lesha from TBEC went to. The timing of those meetings was perfect because countries were just about to begin drafting the AMR declaration. And I think overall, the hearing was really successful, and it ensured that the entire AMR community was aware of the TB priorities. So in terms of where the AMR declaration is at, negotiations started in early June, and they were aiming to have a final declaration by mid-August. The declaration was supposed to be finalized then, but there was something called breaking the silence, where countries have an opportunity to disagree. And several countries disagreed with the text. Luckily, it wasn't anything to do with TB. It was to do, I think, with agriculture. And so they opened back up the negotiations, and they've been going on since mid-August. And I have some exciting news, some breaking news today, which is that we understand that the president of the UN General Assembly has just proposed a final draft to member states. So that should be the final version. It's possible, it could be opened again and they could go back to negotiations, but we should have a final version now. And we're just working on a news alert now, which we'll send out to everybody, sharing what we hope will be the final version. So in the latest version, tuberculosis has 7 mentions, so much better than the 1 or 2 mentions we were told from people on the inside when we started developing the key asks. So that's great. But of course, it's not about quantity, it's about quality. And I think the key highlight is there's a dedicated paragraph on TB that recognizes drug-resistant TB as one of the key components of the global challenge of AMR. And that paragraph talks about the fact that it poses a critical challenge and it could reverse the progress against AMR and the Sustainable Development Goals. And I'm pretty sure tuberculosis is the only disease that has a dedicated paragraph like this. So I think it is a really big deal, and it shows that all our advocacy efforts have really paid off. Some other TB highlights. There is a paragraph that the TB community proposed that recognizes the need to support vulnerable groups and recognizes the socioeconomic challenges and the financial hardships faced by people with AMR. And it also talks about stigma. And so even though that paragraph is focused on AMR and doesn't mention TB, it was the TB community that pushed that paragraph and said, we have to include that focus on vulnerable groups. So I think we can be really proud of that. And that's from our key asks. The declaration also has a paragraph that mentions Stop TB Partnership's Global Drug Facility as a key procurement and market shaping instrument. And it recognizes its key role in supplying TB and AMR medicines. So that's a really big success for Stop TB because it will help our global drug facility hopefully, reach even more people with medicines given that recognition. So that's another big success. The TB community also pushed vaccines and said vaccines need to be a priority. And vaccines are mentioned 17 times. So that's really exciting. There's a focus on affordability and access to vaccines, promoting local capacity and transfer of technology. And a lot of this language on vaccines was pushed by our key ask document. So again, even though it maybe doesn't mention TB, we can be really proud of that because the TB community pushed that. There's also inclusion of text on the right to the benefits of scientific progress and its application to advance towards universal access and treatment. And I know we had a lot of our TB partners that work on research pushing that language. So it looks like that will be in the final declaration, and that's I think another success from our key asks. And in terms of the AMR key texts, a big one that we also helped with was pushing for an independent panel for evidence for action against AMR to be established. And it looks like that will be in the final text. So that's another great success for the AMR community that TB helped with. In terms of targets, I think there's going to be mixed reactions from the community. There is a target to reduce AMR deaths by 10%. And I think a lot of people feel that's not ambitious enough. I think if you compare that to TB, I think we had a target to reduce deaths by 90%. So 10% is obviously much less ambitious. It's better than nothing, but I think there will be some mixed feelings on that. There's another commitment to provide 100 million for national AMR action plans. And again, I think that's the only major tangible financial commitment in the declaration. So I think some people will be disappointed that there's not more ambitious financial commitments, especially when you compare that to TB declaration last year, where we had commitments, for billions of dollars per year. That's a bit disappointing. So I think the declaration could be a lot more ambitious on targets. And one of the things in our key asks that we
Было бы
wanted was,
больше амбиций проявить здесь.
Oh, sorry, go ahead.
Владимир, мы почему-то начали слышать ваш перевод.
Это потому, что вы выключили перевод в целом. Его сейчас нет. У меня пропала панель.
Коллеги, Greg, 1 second, just a technical issue.
Yeah, no problem.
Олеся. Коллеги, просим прощения. Олеся, может, пожалуйста, сказать?
Dear colleagues, sorry, just a moment. We need to adjust the translation.
Да, коллеги, извините, нам нужно добавить второго переводчика, и там были сложности технические. Сейчас мы это делаем.
Это, кстати, возможно, хорошая возможность, если есть желание включить камеру и запечатлеть красивое фото, пользуясь этой паузой.
Да, я тоже хотела предложить, самое главное, чтобы у нас мы Грега не перебили.
I'm almost done if you want me to wrap up.
No, we need the translation for the wrap up. Коллеги, все такие красивые. Спасибо большое, что вы включаете камеру. Очень рады вас видеть. Жалко, что не вживую, конечно. Я надеюсь, у нас в следующем году будет больше возможностей для физических встреч. Мы над этим работаем с командой. Коллеги, скажите, когда все? Аля, еще или? Спасибо большое, коллеги, спасибо вам.
Но камеры можно оставить включенными.
Да. Олеся, можешь, пожалуйста, сказать, что у нас с переводом?
Да, Владимир Каплун подключен. Виктория Каспарова, скажите, пожалуйста, вы здесь в чате есть?
Да.
Да, я здесь.
Почему-то
Добрый
я
день.
ввожу вашу почту и ваше имя. Добрый день, и вы не добавляетесь.
Может быть, я зайду заново тогда
Да.
по другой ссылке, если вы можете
Да.
мне выслать свежую ссылку. Спасибо.
Будьте добры, да, спасибо.
Давайте тогда продолжим пока что. Владимир, вы не против?
Давайте.
Хорошо.
Только перевод все равно надо будет включить, он сейчас выключен.
Олеся.
Подключаю. Есть.
Okay, Greg, thank you. Sorry for this interruption.
Oh, no problem. So I'll maybe just finish up by mentioning Stop TB's plans during the UN General Assembly. So we'll be supporting 10 members of civil society to attend the meeting, mainly TB survivors, as well as representatives from our civil society and board delegations. So if you're part of Stop TB delegations, you can get in touch with the representatives who will be attending if you have any priorities you want to convey. We'll be doing 3 events during the meeting. Our main event will be on Tuesday, September 24th, and that side event will be on AMR and TB. It'll be from 5:30 to 7:30 p.m., and everyone's invited. So for anybody that's in New York, you're welcome to attend. We can share the invitation, and it will also be live streamed. We'll be doing a smaller side event the morning of Tuesday, September 24th, and that will be a TB vaccines dialogue to discuss progress on TB vaccines. That's an invitation-only meeting, but if anyone is interested to attend, you can let me know. And we'll also do a small event to launch Stop TB's annual TB governance report. So that's a report on governance policies in countries. And we're finalizing the details of that, but that will probably be Wednesday morning. Similar to last year's high-level meeting, we plan to be highly visible during the high-level meeting. We'll all be wearing red TB scarves. We'll try to sit together. We'll try to do the Yes, We Can End TB chant, and we'll try to make sure that as many people as possible can speak and make interventions during the high-level meeting on AMR. So those are a brief summary of our plans. We'd love to hear any ideas you have. We're very open to suggestions. Happy to answer any questions. And again, I apologize about speaking English, and thank you so much for listening to the translation. Thank you so much for that. So I'll stop there. Thank you.
Спасибо вам большое, Грег. Я думаю, большинство людей вас понимает. Спасибо, прекрасно. Вы орисовали то, что было сделано, и еще раз благодарим вас за
Thank you so much, Greg. Thank you for the great overview of your initiative. Thank you also for the support you have shown to all of us so far. And as for the meetings and the insights, it would be great if Stop TB could share the list of the events with us so that we could spread it on with our partners in the region. And now what I would suggest to do is to have a brief question and answer session. So if you have any questions to Greg, please feel free to raise your hand, ask the questions in the chat. And while you are thinking, I have a question to you, Greg. Again, based on your experience of having high-level TB meetings last year, this year, AMR meeting at the high level, what would be your advice to the civil society representatives in our region? What are the barriers that we could foresee in this work in our region? Maybe you have some experience from other regions, from other countries, and we might just mind your experience and try to avoid the same barriers or similar barriers in our region.
Yeah, thank you for the question. I think number one, I would encourage everyone to find out who is attending the high-level meeting from their governments and encourage them to represent your priorities and send them some advocacy messages. In addition, you can write to your UN missions in New York. The emails are online. I can share the link, but they're always happy to hear from people from their own country. You can reach out to them. Many of them know Stop TB Partnership and TBEC, so you can reference. You can say you may have met my colleagues in Stop TB and TBEC, and I represent this organization, and you can share your advocacy priorities with your UN missions in New York, and encourage them to include any talking points in the speech. Whoever will make the main speech in the plenary segments during the high-level meeting. And then in addition, I would look at the political declaration and pull out what you think are the most important commitments. And I'd ask, your government representatives how they plan to implement those commitments, and, ask for a meeting to discuss. I think we've also found, as everyone knows, members of parliament can be really helpful because it's not always easy to get the attention of the Minister of Health. So contact your members of parliament and bring the declaration to their attention, and see how you can discuss together with the members of parliament to turn the declaration into action, because we all know that political declarations gather dust unless we do all of the work to bring attention to what's in them. So those are a few thoughts that come to mind for me.
Большое спасибо. Я думаю, что часть из них у нас уже
Thank you so
реализована
much.
в
I
регионе,
think
но
that
тем не менее
partly
большое
we
спасибо, что вы
are
вернулись
already doing this in the
сегодня.
region,
Я
but thank you
вижу
so much for
рука у Юли.
bringing this together. I could see Yulia raising her hand.
Да, коллеги,
Please, Yulia, the
спасибо.
floor is yours.
Грег,
Yes, thank you
я
so
задам
much.
вопрос на русском.
Greg, I will be asking my question
У
in
меня вопрос.
Russian.
Насколько мы
Hopefully,
знаем,
hopefully
в
you
этом
can hear the
году у
interpretation.
АМР
So the question is as follows. As far as we know, this year,
даже, наверное,
really very good
с
results,
тем, когда
AMR
мы
results
работали над
have been
включением
achieved,
ключевых
even
запросов от сообществ
compared to the period when we
в
worked on
декларацию по
including the
туберкулеза.
key needs and key
Где вы
asks of the
видите
communities in the
секреты
TB
этого
declaration.
успеха?
So we have really
Почему
good AMR results
получилась
this year.
декларация по
So
АМР лучше
what do you think
поработать?
is the
Если здесь
reason for this
заслуга
success? Why
сообществ,
the AMR declaration
потому
has
что по,
worked better
скорее
than the
всего,
TB
проложена уже
declaration?
тропинка
Do
с
you think
декларацией по туберкулезу, или же
it
вы
is
видите
because the
какие-то
community works
другие,
better now because we have some
другие
experience of
подходы, которые
working on
позволили
TB
поработать
declaration,
этот
or
вопрос
maybe
лучше
there are
именно
some
с этой
other reasons
декларацией,
that have
и чтобы мы эти уроки
promoted
извлекли для себя и
this
могли
phase
тоже в
better
дальнейшем
than the
применять,
previous
потому что это
phase. So
не
maybe some
последняя
good
встреча
lessons
высокого
learned.
уровня,
Could you
и
please
для этого
share
мы эту
this if
встречу
so?
проводим,
Because
чтобы понять,
these
какие
lessons
были вот
learned would
эти
be also beneficial
успехи,
for
или
us
наоборот
for
неудачи. Спасибо
getting
большое.
prepared for future high level meetings. Thank you so much.
Yeah, I agree with you. I think a lot of us have just become experts because last year we kind of had the training wheels on, and a lot of people hadn't engaged with high level meetings before, and we learned so much about how to influence and how to be involved. So, for example, we knew the importance of engaging with the multi-stakeholder hearing in May, and we were just so ready for that. We were able to line up 21 mission meetings. We came prepared with our key asks. So I think that was really helpful, the experience we gained last year. And I think second, the AMR community is not nearly as developed as the TB community in terms of community involvement. So I think we really stood out in all the AMR discussions because we did involve our communities. And I think one of the reasons why so many of those UN missions engaged with us is because they were excited to meet people from the countries who are working on the ground. I think they're very bored of, meeting people from, the usual countries, and for them they were very excited to meet people who were working on the front line, so that gave us a lot of credibility. So those are two things that come to mind. I think in terms of lesson learned, it's just having very clear asks, making sure the community voices are engaged and involved, and bringing them to New York. I wish we could bring a lot more people to New York. 10 people is not nearly enough. We do have some others coming as well, but that makes all the difference, because otherwise these discussions in New York take place in a vacuum. And I think the TB community has just done a great job. Our communities have done a great job. We're lucky to have so many people like all of you. That makes a difference, because AMR really does not have that, I think.
Thank you so much.
Большое спасибо за такие вдохновляющие
Thank you
слова.
so much. Very inspiring indeed. And again, thank you personally, Greg, for the support. Thank you to Stop to Be for the initiative, for the advocacy. Again, colleagues, if you have any other questions to Greg, you can always write them in the chat. hopefully Greg will stay for a while at this meeting. And now let's move on and over to our colleague, very reliable partner in the region, Olga Klimenko, who is going to represent the community at the next high-level AMR meeting. So Olga, could you please share your expectations, your vision of the civil society role, and hopefully we could also discuss with you some potential messages that the meeting participants today could suggest or recommend to you to present at the high-level meeting. Yes, thank you. I also hope for a very efficient and good discussion. I would like to split my presentation in several blocks. First of all, I want to welcome everyone. I'm really happy to see you all here at this discussion as to how we can combine the efforts of different components, different audiences, and the community to promote the AMR agenda. I want to thank the organizers and, of course, the Stop TB Coalition for holding this event, because it is very important and it serves to the strategic mission of achieving the results, including the reflection and involvement of the civil society and reflection of the role of civil society in the process. So again, we, the platform that unites dozens of TB NGOs, try to ensure the involvement of the civil society in the drafting and formulation of the national policy. And so again, in order to make the discussion easier, let's first try to remember what AMR is and why we need to respond to it, and what is the threats associated with resistance for ourselves and for the future generations. The discovery of antibiotics is one of the greatest discovery of the previous century, but scientists today forecast that soon we might be facing a period and antibiotics would be no more efficient and we will start facing more epidemics because of the improper prescription and improper use or abuse of medications in general and antibiotics, because antibiotics need to address the problems that are associated with bacteria that generate toxins, intoxicate the body, and affect the quality of life. But antibiotic resistance is a huge threat to the economy, to the humanity today, creating problems individually and in the public domain. In order to control antibiotic resistance, and there are a set of strategies and tools that is known as administration of antimicrobial medications, and that's why it is very important that AMR would also include the TB control medications, because we know that tuberculosis is a very strong infection, a very strong bacteria. So if the humanity is facing antimicrobial resistance, then we will be in a position that we would not be able to control TB, and TB will definitely lead to disabilities, which will have an economic as well as humanitarian impact. So the major rule today is to use antibiotics only as the last resort, very clearly calculate the dosing and try to evaluate the risks. And this is the task that needs to be fulfilled by doctors, not by ourselves. Some statistics, however, show that even in the healthcare system, the administration of antibiotics is not always safe. And today, when we have a lot of MDR cases, we have a huge rates of in-hospital nosocomial transmission of MDR TB. For instance, in Latvia, it might be as high as 70%, in Malawi 72%, in Spain 42%, in some US states also about 50%. So we have these statistics for all of the countries, including our region. This is in hospital MDR TB transmission statistics. And of course, there is a whole set of factors that promotes the development of antibiotic resistance. So in addition to very clear administration policy that should be an integral component of the healthcare system, there also a need to create infection control programs, response programs, and these programs should not stay on paper, but should be implemented at the country level, should be duly very closely monitored and controlled. And this is where the civil society might play a pivotal role. So specifically, what can we do? So the Global Action Plan, or GAP, as it is also called for AMR, WHO approved at the 68 WHO, and the purpose, the mission of this plan is to ensure treatment of infectious diseases with efficient and safe medications used responsibly and available to all those in need. There are 5 strategic directions for this. First is the awareness raising and understanding of what
reduction of the number of people who get infected thanks to improved sanitation and the strategy of infection control, optimization of the use of medications to treat people and animals, and customization of the regimens for in each country, and investment of new research in vaccination and treatment drugs. Why is it important today, and why we need to be very active about that? Well, because from the recent things, GDF has recently sent mails to different countries about the possible deficit of delivery, some interruptions in supply. And in Ukraine, we have already encountered that. We have delays with supply caused by external factors, not by something that the country itself did. So being a part of the implemented policies is very important. And using the fact that I will take part in that meeting, I would like to thank the Stop TB partnership for this support because it's a big opportunity to take part and speak at such events, promoting the interest of the community and civil society. My speech and my comments will be focused on drawing attention to why tuberculosis cannot be stigmatized and considered as a separate disease. It needs to be a part of the general policy of fighting AMR. Why do we why are we in favor of this work of this inclusion of TB measures in the declarations? Why do we continue fighting daily for the rights of the people to get quality assured health healthcare and social support, and why it's important to support all the people who are vulnerable to the infection. I will be speaking about all these things, and I will appreciate your suggestions, your ideas about what is also important for us as of today, what needs to be spoken of, what needs to be, well, the focus of attention. And I will appreciate the moderation of this discussion with the participants of today's meeting. So thank you for
Оля,
your
большое
time.
спасибо
Thank
за
you very much, Ola, for this
подробный такой анализ
comprehensive
связи
review of
тематики
the
туберкулеза
link
и АМР.
between
Действительно,
the
эти
topics
два
of
явления, к сожалению, между
tuberculosis
собой очень
and
сильно связаны.
AMR.
Коллеги,
Unfortunately, yes, there is a
есть
strong connection
предложение
between these two topics.
задать
Dear
Оле
colleagues,
вопросы, если у вас
so the
они
suggestion
имеются
is you can ask
по сегодня
some
только.
questions.
А также
Raise your hand for
внести,
that.
может быть, свои какие-то
Or
мысли или
maybe you could
предложения
provide some
к будущему
suggestion
стейтменту,
about
который,
the
как я понимаю,
future
Оля планирует
statement, which I
готовить на
think
совещании
Ola
высокого
is
уровня по антимикробной
preparing
резистентности.
for the
Я вижу
UNHLM
на
on
подиуме
AMR.
у
I
Натальи
see
Сумской.
that
Пожалуйста,
Natalia
ваш
Shumskaya
вопрос,
has
комментарий.
raised her hand.
Здравствуйте. Очень важная
Yes,
тема.
thank you. It's a very
Я бы
important
хотела
topic.
спросить, может,
And I
кто-то
would like to
знает,
ask, maybe
прокомментирует.
some of you know
Оля
and could
отметила,
comment on
что
that.
вот
Ola
такое
has mentioned that
отсутствие контроля
this
да,
lack of
в сельском
control
хозяйстве при
in
выращивании скота,
agriculture when
использовании
they grow the
антибиотиков.
cattle and
Вот
use
представители
antibiotics for that.
Министерства сельского
Representatives
хозяйства
of
будут принимать
the
участие?
ministries of
Планируется ли, как
agriculture,
вообще
are they going
можно
to take part in
воздействовать
that
на
meeting?
них,
Can we
чтобы со
somehow
стороны государства был очень
influence them
жесткий
so
контроль
that
поставлен
states
на
establish
этом
strict
пути и
control
какие-то
of antibiotic use in
все-таки,
agriculture? So
может быть, и участие
something
гражданского общества в
could
том,
be done,
чтобы
and maybe civil society
осуществлялся,
should
я не
take
знаю,
part
потому
in
что вот мы
that
как
control
АМР,
as
лично
well.
для меня
I
вот
don't know,
это новая
because we
тема,
somehow have not been
может,
engaged in
как
that
кооперироваться с
activity. Maybe we need
организациями,
to
которые работают в области
cooperate with
экологии.
the
Вот
eco
такие у меня мысли, может,
organizations,
есть какие-то
with
комментарии,
environmental
идеи.
activists.
Спасибо.
Maybe you could comment on that.
Благодарю, Наталья, за
Thank you very much, Natalia,
мысли.
for your suggestions.
Эта тема новая, и,
This topic is
конечно,
new,
готового ответа нет,
and of
но
course, I don't
из того,
have
что я могу сказать,
an answer to that right
основываясь
now.
на нашем опыте,
But
первое, это,
based on
конечно,
our
важно
experience, well, the
усиливать
first thing is
вовлечение
it is
гражданского
really
общества и
important
сообщества
to
в все эти
strengthen the
процессы.
involvement of the
Тема
civil society
антимикробной
and
резистентности, она
community
новая
in all
для
these
сообщества
processes. The
исследовательского общества,
AMR
потому
topic
что
is
на
new
моей
for the
истории,
civil
на моем
society
опыте
because,
впервые
from my
за
experience, it
8
is the
лет мы
first time that in
рассматриваем
the 8 years we are
антимикробную
discussing
резистентность вместе с туберкулезом.
antimicrobial resistance in the
И
context of tuberculosis, together with
основываясь на
tuberculosis.
тенденции, чтобы
And
усиливать и принять
considering
меры, мне
this
кажется, что
trend
организации
of
гражданского
like
общества должны
taking
вникнуть
action,
в
strengthening
эту
the capacity,
тематику,
I think
проводить
the civil
открывать
society
диалоги, консультации
organizations
на
need
уровне
to
своих
learn
стран.
more.
В
They
конце
need to
концов,
educate
раньше мы
themselves
про
about this
туберкулез
topic. They
мало
need
что
to raise
знали, про
awareness
него
about in
говорили
their
какие-то
countries.
мнения и
Because,
понимания.
like
Поэтому все
we
возможно,
used
в
to
том
be a
числе для
little
новой
aware of
программы
tuberculosis. We
ВВН.
didn't know
И,
how to
конечно,
advocate
если
for these
говорить из
things. So,
того, что можно
of
делать
course, we can
сейчас,
do
и
everything right
Украина
now.
это
And if we
активно при
speak about
поддержке
something that
ГКП
can be
использует,
done right away, Ukraine does it.
многосекторальная подотчетность
It's
МАФ это инструмент, центр, который показывает,
MAFTB,
который, если внедрять на уровне стран с
multi-sectoral
активным вовлечением
accountability framework.
сообщества,
If we
действительно
implement it in the
показывает
countries,
уязвимые места в
actively involving
государственной
the
программе,
communities, it
в
shows the
которые
gaps
приоритетно
in the
необходимо
NTP.
внедрять вмешательство, чтобы
It shows the places that require
способствовать улучшению ситуации на
intervention
уровне стран и
to
расширять
improve the
программы.
situation in the countries
Потому
and
что
expand
я уверена, что
and
если мы
scale up
сейчас
the
придем,
programs.
да, как бы в
Because I'm sure that
аграрный
if we just now come
сектор,
to
сельскохозяйственный
agricultural
сектор, как и многие
sector,
сектора, которые раньше
as
не
many
вовлекались в
sectors that used to
туберкулез,
be,
например, для них
well,
будет тоже
not
вопросом,
involved in
почему мы к
tuberculosis,
ним пришли и с
they will
какой
ask
целью мы
just
к ним пришли.
why
Поэтому я
we
думаю,
come
что
to
это
them and
хорошая
what we want from
промежутка
them. So I think
использовать
that's a good
инструменты
starting
Stop
point.
TB,
We need to
использовать те
use
инструменты,
the tools
которые
of Stop
доступны
TB partnership.
при
We need to use the
поддержке
tools
ЕКСБ для того,
that
чтобы
are supported by
расширять
TBAC
деятельность сообщества.
to
Раньше
scale
мы
up,
говорили,
to
что нужно министерство,
expand
да,
the
туберкулез
activity
вывести
of
в отделы
the
политики здравоохранения. А теперь мы стоим
community.
перед задачей
Well, we used to speak about the fact that we need to go
да, как бы
beyond
расширять эти
the
экспертизы.
healthcare if
Поэтому
we
это
speak about
долгий путь,
tuberculosis.
но начинать
And this
нужно.
is what we need to do now, but we need to get more expertise. But
Оля,
it's a long
спасибо
journey. Thank you very much, Ola, for your answer, and thanks, Natalia, for your question. I just wanted to add that the MAFTB that Ola has mentioned in the context of this question is really a possible solution allowing to well enable good cooperation of all stakeholders, all the public authorities, and the high-level meetings and the political declarations adopted after those meetings are a good advocacy basis for implementation of MAFTB in the countries. And I would like to remind you that the political declaration on tuberculosis adopted last year, out of 84 points, there are 7 points that directly indicate to the need to develop and strengthen multi-sectoral approach. And you know that the political declarations are adopted by the governments of the country, so it's above the Ministry of Healthcare or Ministry of Agriculture. So using these connections and using these important strategic documents, international documents, we can promote these topics in the countries. However, based on our experience of many years, it doesn't work so simply and smoothly. It takes time, but we are confident that this is a possible solution to the problem of tuberculosis. In joining the efforts, I see Yulia Kalancha has raised her hand. Yes, I just wanted to say that because Natalia, it was a really good question about this connection. And my question is, who in your countries at your NSPs, National Strategic Plans on Tuberculosis, you mention ministries of agriculture as a stakeholder, someone that needs to be contacted in the context of tuberculosis. Those of you who have read the strategic plans, do you have partners from the Ministry of Agriculture in those plans? Because it's a question to us as well. Because if we know about the barriers, about the issues, about the partners who are not included in the TB response, because AMR is also one of the aspects. Yesterday, Luchika, if you attended the webinar conducted by the Stop TB Partnership on Sequencing, Luchika said this good connection between AMR and new drugs, because we must prevent this situation when new drugs get resistant. So we need to do as much as we can to prevent this resistance forming. Of course, it will happen sooner or later, but we must make it so that it happens later. So this is what Alexandra mentioned. We need to understand the barriers. We need to understand the problems in interaction, because not every ministry, even not every Ministry of Health, understands why they need to cooperate with us. And the question is, well, what's the connection between the Ministry of Agriculture and tuberculosis, or Ministry of Social Policy? They may not have the understanding of how other ministries may be involved in the problem of tuberculosis. So we need to do the assessment. We need to track the negotiations. We need to build up the political will and promote these topics, including the involvement of other ministries in TB response, including them in the national strategic documents. Thus, we will close this circle, and we will not have to come back with the same questions every time when these ministries and the tasks for them are already in the NSP. Thank
Спасибо,
you.
Юля, за дополнение. Коллеги, если у
Я
кого-то
только
еще...
что посмотрела, извиняюсь, в ответ, да, наш по Кыргызстану, Министерство образования
Yes,
включено.
you know, I have just looked into response of the Ministry of our government. It includes the Ministry of Education, the Ministry of Health, but the report does not include the Ministry of Agriculture. Yes, Natalia, you have just been through the evaluation of intersectoral cooperation, and actually when you make the list of all these ministries, ministries, you have to look at their policies, at their activities, and you need to see if these domains or activities have any connection with TB, and if TB is actually relevant for any of these ministries or departments, and then you just interact with these ministers. So, and what you have just mentioned, the report specifically mentioned very traditional ministries like Ministry of Health, but they are missing the Ministry of Agriculture and some others. Yes, indeed, and I think that this is typical for many countries. These lists do not include ministries of agriculture. So it will be interesting to hear from you if in any of your countries these lists do include the ministries of agriculture. Again, if you have questions or comments, just reminding you that you can raise your hand and ask the question or voice your comment, or you can do it later. You can email your questions to us. You can email your proposals to myself, to Olga. Please, you can reach out to us for Olga's email. And Olga, thank you so much. Good luck in representing the community of the region at this very high level. And we will keep our eye on the final text of the political declaration. And just in the final run, I would like to share our theoretical and practical recommendations for the treatment of people from the community. So we have recommendations for TB and AMR, and I have just inserted a link to the instruction in the chat as to how you can choose the language that you want to see the slides in. So you can actually choose the screen demonstration in two options. So Lesya is going to share the slides in English and Vlada Rabinova in Russian. So I will try to be really quick. So next slide, please. Again, when we speak about the participation of civil society organizations, CSOs, and communities in the processes for preparing for the high-level meetings, we can actually speak about 6 major steps, and you can see them on the slide. We will be sharing the presentation later. So first step is to draw the attention of the government, leaders of the government, leaders of the ministries in the to helping them to focus on the need to participate and develop a really good text of the political declaration on TB. Next step is to promote the participation of civil society organizations, TB communities in different the different accompanying meetings or activities. So then we need to advocate for including the CSO and community representatives in the national delegation so that the people who will represent the country at the high-level meeting would really represent the community and the wide audience. So then we also need to actualize the key and develop the key asks of the communities and CSOs to be included in the political declaration, and then making efforts to have them included into the political declaration. Again, we need to coordinate these activities with country missions, with politicians represented at the meeting, because actually the mission representatives also participate in the development, in the drafting development of this declaration text. And as I mentioned before, of course, we need to try our best to have the CSO and community representatives included in the delegations and invited to all accompanying or side events. Of course, we cannot now discuss all the steps in detail, but I would like to propose you some materials that would be really helpful in how you could prepare for all these steps. And you can see these brochures, these guidelines that actually describe what practical steps the civil society could make at every of these 6 steps. And they also present very practical examples, templates of official letters. So these are really very practical guides that you might use to get prepared for the high-level TB meeting in 2028 or any other high-level meeting, including the ones that are going to be held this year. Also, please pay attention to the fact that the PASS Center has also published another brochure. This is the green one, which actually speaks about the lessons learned and practical recommendations about the role of civil society and communities, TB-affected communities, in the preparation for the high-level UN meeting on TB. So this brochure discusses the barriers to participation and shares recommendations as to what could be done to overcome the barriers and eliminate the negative influence on participation of communities and civil society organizations in the high-level meetings. And so I'm sorry, but I'm not quite sure if you can also see the slides in English. I cannot see them. Just give me a sec. So could you please switch to the next slide in the English language? So next slide, please. And what I wanted to tell you now is a couple of words about the actual participation of the CSOs and community representatives from our region at high-level meetings. So here you can see 4 representatives from the region who participated in the high-level TB meeting last year as members of the national delegations, and they worked in the national delegations, country delegations, and they shared the recommendations with us later together with the delegations themselves. And we wanted to share these recommendations about the role of civil societies and communities. So next slide, please. As you can see from this slide, we have identified 5 major recommendations that could be, of course, subdivided into more specific steps or activities. So the priority number 1 is to advocate for the interests of people with TB, underlying and stressing the problems they are facing and raising the awareness about these problems and trying to have the governmental organizations make some commitments to address these issues. Also, as you probably know, that high-level meeting delegations include profile ministries and departments such as health care department, health ministry, AMR departments, but also these delegations include representatives of foreign ministries of foreign affairs and some other ministries that are not directly related to health or TB. So it will be very important to raise the awareness about TB or AMR, and they could then reflect it in the official presentations or reports. Next priority is to promote innovations in order to scale up some best practices that really proved efficient in a certain region, in a certain location. Then next priority is to ensure inclusion in drafting political declarations so that these political declarations would reflect the interests and needs of different population groups in different domains and would help cope and combat stigma. And actually, you can keep an eye on your country delegation, on what they say in their presentations, so that you would be able to minimize the use of stigmatizing language in their presentations. Also, if we have multi-sectoral country delegations, that actually helps improve the image of the country. It's very important to remember that in the preparation of the high-level meetings, the UN usually issues a model resolution about the timing, the location, the agenda of the high-level meetings. They usually do it at the beginning of the year when the high-level meeting is planned, and they usually in this communique offer certain major key things that they are going to discuss, and also some key recommendations. And in recent such communiques, the UN has recommended to the countries to make their country delegations multi-sectoral. So when you try to actually communicate this need for including for making the delegations multi-sectoral, you can always refer to this communiques by the UN. And again, the fifth recommendation, the sixth point is to ensure the accountability of the governments and of course, after the high-level meetings, the governments feel in a better position to actually ensure monitoring over certain activities, and the civil society feels in a better position to ensure monitoring over the government's activities. And I think what is also necessary is to ensure 24/7 communication, awareness raising about what is being done, what has been done, what is planned for the future. And in reality, we have some unified mechanisms that could help CSOs and communities to work on TB, to work on AMR, or on any other topics of any other potential high-level meetings. So first, you can address the governments, the leaders of the governments, asking them or recommending them to participate in this high-level meetings. Because the higher the status of your country's representative at such a meeting, the higher chances for him or her to be heard and for the country to be really well represented. That's why it's in the interest of the country to be represented by a high-level official. Also, civil society representatives can try to also promote their delegations, their participants, their representatives to the country delegations. And even if you fail to do so, you can try to communicate the kiosks of the communities to the delegation members through the Ministry of Health, the Ministry of Internal Affairs, through the UN mission in your country, try asking them to make sure that the country delegation knows about your kiosks of the community in your country, and includes this into their presentations as well as into panel discussions during the high-level meeting. And You can see all these forms here.
Рассмотреть ключевые туберкулезные запросы
actually,
включить их в
these
выступления
are
на
the
совещании
requests
высокого уровня.
that the country sent previously last year to the delegations, to the meeting organizers, asking them to include certain key issues into the discussions, into the panels. And we are absolutely sure that at the country level, and as well as combining national, regional, and global efforts, we can really get good results in the sense that very key things would be included into the text of the political declarations, would be voiced at the high level. Again, raising the awareness about TB. And this will be also very helpful in terms of advocacy. So we are always ready to support all those who want to be part of these processes. And let me now present
брошюру, которую подготовила ЕКТБ при
I would like to
поддержке
present a brochure that has been prepared by TBEC, supported with the Stop TB partnership. This is about implementation of the political declaration on tuberculosis, where we identified the key points that include the asks, and for each point we have chosen relevant and proven advocacy tools. We provided detailed descriptions and links. You can use the QR code to access our site and see the document. I hope that it will be useful for you, because now is the time to get active in the context of implementing the commitments taken by the countries, and the information in this document, we believe, will help representatives of the civil society and the communities to justify the activity they perform or that they plan. And that also concerns the preparation of grant applications. So by learning about this international strategic advocacy basis, you will sort of strengthen the work you do, make it more impactful, your work that you conduct with the public authorities. I think this is it. The next slide. Thank you for your time. And if you have any questions, well, I don't think we have time for that now, but you know how to contact us. So thank you very much. And if anyone would like to add something right now at the end of our meeting, or we have forgotten to ask some question that you had, we can have 5 more minutes for that.
Вопросов нет.
No questions.
Мы вам все вышлем.
So we will send everything to you at all our sites. You know that there are links and pictures. You'll have everything. We will share the information from this event, and we will appreciate your active participation in further processes during the event, before, and especially after this meeting. When we will work on accountability, I would like to thank our speakers today. Thank you very much for finding the time and joining our meeting. I want to thank our participants who have also found the time in their tight schedules to hear about what is going on, about the global important issues. And I would like to thank our interpreters, without whom our meeting would not take place. Thank you very much. Sorry if we spoke too much or too fast, but I am sure that it has worked out well. Thank you. Okay, that's it, colleagues. Let us wrap up. Goodbye. Thank you very much, dear colleagues. Let's see each other once again and say goodbye.
недели. Спасибо
Have a
большое.
good end of the week.
Спасибо. Спасибо,
Thank
Наталья.
you.
Thank you, Paul.